Hi, and welcome back to another installment of How to Start a Home Healthcare Agency. In the last video, I talked about your policy and procedures. In today's video, I discuss your initial licensing survey. If you want to know what you should expect, how to prepare, and want to improve your odds for having a deficiency-free 45-minute survey like we did here at AidBook, this is the video for you. Here on ENTP Life, I mostly cover real estate and my personal interests. I also cover my primary business, which is home healthcare. I decided to teach others how they can get started in this lucrative business. I've been able to build a multi-million-dollar home healthcare practice that employs hundreds of healthcare workers. So if this is the sort of information you want more of, make sure you like this video and subscribe to the channel so you get up-to-date information on building your own home healthcare practice. Also, if you want to demo the best home care software for personal care agencies and social adult daycares, make sure you reach out to me or register for our weekly software demos right in the link below. With our software, OnTime ITS, you're able to manage your staff, your patients, time and attendance with EVV, billing, payroll, and so much more. If your goal is to succeed in this business, OnTime is a software solution of choice. In this video, I'm going to answer the following questions. What is your licensing survey? How to prepare for the survey? What happens during the survey? And what happens after, even if you pass or fail? So to answer the first question, what is your licensing survey? It's really important to understand exactly why you go through a survey in the first place. You see, when you're running a home healthcare agency, you're really operating a healthcare organization in the individual homes of several people. And what I mean is you're running an organization a lot like a hospital or a skilled nursing facility, except you're not under one roof. You're under the roof of many people's homes. So when the state looks at you, they're really looking at you from the perspective of, is this organization fit and able to manage people outside of a facility in multiple locations? So they really scrutinize how you're organized and if you're set up in the right way. Licensing surveys are going to come in a few different forms. The initial licensing survey is just to make sure that you check out and that you have everything in order so that you could start your business. Then there's your relicensing surveys that are usually done at years number 1 through years number 3 after you started your operation. This is to make sure that you stayed on the right and arrow so that you're doing the right thing and making sure that those patients are safe. The other type of accreditation survey is your survey for Medicare. Now, the Medicare surveys are much more complex because you're dealing with a federal payer source. So they really dig deep into how you're running your business. I would say the Medicare survey and your relicensing survey are going to be very similar because they're looking at employee records and way more information than your initial licensing survey. With that being said, that doesn't mean that your initial licensing survey is some sort of joke. It's to be taken very seriously, and you should be well prepared in order to succeed in that survey. These surveys are going to dictate whether your company stays open or closes. So it's really important that you take this point that it's a very serious event, regardless if you're just getting started or you've already been running your business for multiple years. There's many stories out there that people can't even get past this phase or have had their agencies shut down because they didn't pass their surveys. During your survey, a representative from the state or your accreditation body is going to meet with you at your office to review all these items that are going to be predetermined from that surveyor to make sure that you are in compliance and you're running a good organization. So if you've seen our previous videos, you know that we're working with a consultant for our licensing process, and that's really a good move. The reason why is because they give you a checklist of all the items that you should expect to have in order to pass your survey. So when preparing for your survey, it's important to know what they're looking for and have all those things in order. So on our checklist, we had about 30 items that we needed to satisfy, from things such as making sure that we have our posters on the wall for labor laws and our time of opening and closing, our 24-hour hotline, to things as complex as your first board meeting. They're going to review everything that you have on file to have gotten yourself started, your initial employee records, and all those things. So knowing what regulations they're going to review, what files they're going to review, and what they expect to see is important because you can make sure all those things are in place and readily accessible for when the survey comes so that you're able to demonstrate that you're competent and that you're a very well organized company. So what we did to prepare was literally go through our checklist one item at a time. If it was a regulation related thing, we separated that piece of the regulation out into its own folder, both printed and in digital format. Another thing that we did was mark off any section that they're going to be referencing with a little tab so that we're able to flip through our policy and procedures manual quickly and identify those items that are on the list. My recommendation for preparing for the survey is literally to take one person on your team, have them go through the checklist, organize everything, and then have one person who's your compliance person come in like a complete stranger and actually go through what you would think a survey would be like. Literally ask for each item one by one and make sure that the person who's being surveyed is able to produce those things. If they're not, you're not prepared. Like all things in life, the more you're prepared, the better your outcome is going to be. The reason for that, especially when it comes to surveys, is that you want to present yourself as competent and trustworthy. If you're someone who can't even figure out where your policy and procedures are or where to reference your patient bill of rights, what do you think the state is going to think, or what do you think that survey is going to think of you when it's time for you to manage the life of someone who's end stage or someone who's living independently and requires 24-hour care and has Alzheimer's disease? What are you going to do when that's your situation? You're not going to be prepared for it. So the more that you're prepared for your survey, the better the outcome is going to be. Your initial survey is going to be announced. Your relicensing surveys are going to be completely random. But for the sake of this video, since this is how to start a home care agency, we're going to talk about your scheduled and planned initial licensing survey. The surveyor is going to give you a date that they're expected to come. Make sure you're prepared and you have all those documents organized. The surveyor is going to come, introduce themselves, and start calling in random order what they want from you. They're going to have their own checklist of items that they look for, and they're going to also have like their aha or I gotcha moments. So be prepared for things that aren't even on the list, and stay calm and make sure that you always reference your policy and procedures as well as the regs when you're being asked questions, especially for things that you don't understand. In our survey, we did it virtually. So we actually did it through a camera because of this whole COVID-19 stuff. So we walked around with our camera, showed them the policy and procedures that we had. We showed them our posters that were on the wall, our signage, how we have our manuals organized. And then there was a moment where they interviewed each of the founding members, the administrator, which is myself, as well as the director of nursing, which is Mark Murray. And they wanted to see how competent we were in our respective areas. They wanted to make sure that we had the right amount of experience and that we weren't just a group of people trying to start a home healthcare business for the sake of making money. The survey acts to review all of our initial meetings, meaning our initial committee appointment meetings and our initial board meetings, to make sure that we are set up in a way that we have a governing body that's really looking at what we're doing so that we're not just running amok. Believe me, anybody who's worked in home health care knows there's a few different types of agencies. There are the well-organized and well-managed ones, and a bunch of smaller mom and pop shops that really aren't doing that good of a job. Actually, in New York, there's a big movement to consolidate and weed out all of the smaller players in the industry, because the smaller players tend to have the same problems. They're not well organized, they're not doing a good job of taking care of their patients, and it actually creates more work and more oversight for the state and the governing bodies that are accrediting these agencies. So our initial survey was scheduled for 2 hours and we were done in 45 minutes because we were that prepared. That's the sort of situation that you want to have for yourself. You want your surveyor to walk away from that experience thinking, now this is one of those agencies that are really going to succeed. So it's really important to be well prepared and also to be very even-tempered so that you're not upsetting the surveyor, because at the end of the day, this person's a human being and they're in that role because they actually like to manage people and have that layer of responsibility. So it's important for you to establish rapport and maintain that rapport by being polite, courteous, and well organized. Now, at the end of your survey is going to give you a debriefing. They're going to let you know how you did in general. They're also going to compile everything that they reviewed and do a final report. It's in this report that you learn whether or not you've passed or failed. Now, you don't really fail surveys, you get what are called deficiencies. These deficiencies are detailed and referenced against some sort of policy and procedures or some sort of regulation that you failed to hit. They're going to give you an explanation of why there was a deficiency, and then you have to come up with a plan of correction. The plan of correction is exactly what the name implies. It's your organization's plan to correct that deficiency. So you're going to have to review the regs and make sure that your plan is in line with what the regs expect. This is why it's important to have a consultant. So if you need one, make sure you reach out to me and I'll introduce you to ours. But in this plan of correction, you're going to reference the regs and you're going to really look at what you did wrong. Then you're gonna come up with a plan of how to educate your staff so that they know what the mistake was, and also a plan for how are you going to ensure that this doesn't reoccur. All of these things need to be in each deficiency item so that when the person reviews your deficiencies, they see that you understand why you were deficient and that you have a clear plan to correct it and a clear plan to maintain it. Keep in mind that this list of deficiencies, they maintain them. So when they come back around in 2 or 3 years, when they're doing your next survey, they're gonna go straight for those to make sure that you actually isolated them and corrected them. And that's gonna keep happening until you come down to a list of no deficiencies. Most surveyors are going to hit you with some sort of deficiency because they want you to practice and exercise staying on your P's and Q's. So when you're doing your relicensing, don't really get too bummed out if you have 1 or 2 minor deficiencies. That really means that you're doing an incredible job and that the state or the surveying body just wanted to make sure that your team is staying on their toes by keeping up to date and making these sort of corrections so they don't lose that skill. So in the event that you do pass your survey, what's gonna happen next is that you're gonna get either a notification by mail or email saying that you've passed and what the next step should be. Here in the state of Florida, the accreditation body actually sends their recommendation to the state. When the state receives that approval, they then issue you your license to start running your home care practice. Now that license was sent to us via email, we printed it out, and like it says, we mounted on the wall in a visible place so that anybody who walks in knows that we're licensed, what our license number is, and can actually track back and contact the state to make sure that we are licensed and in their registry. Once you're licensed and open for business, that's when things get real. In our next video, we're going to talk about getting your first patient, how to market your agency, and how you should use our software from day one to keep your company well organized and on the path for success. So don't forget to subscribe and register for our weekly software demonstration by using the link below. I'm glad that you're in this phase of your journey, and I'm looking forward to your success. Take care.